gentlemen get a chance to look the agenda over.
Motion to approve.
I'll second it.
And moved and seconded to approve the agenda. Call for vote. Primer, aye.
Seaman, aye.
Beershank, aye.
How about the minutes? Get a chance to look them over? Any additions or corrections? I saw nothing.
No, I didn't either, so I'll make a motion to approve.
Second.
Okay. Minutes been moved and seconded. Call for vote. Primer, aye.
Seaman, aye.
Beershank, aye.
How about the claims, fellas? Any questions?
None.
Motion to approve.
All right.
So you're gonna, okay, get them separate, so I'll second that.
The ARPA's, yeah, okay. Claims been moved and seconded to approve, so call for vote. Primer, aye.
Seaman, aye.
Beershank, aye.
Now the ARPA. Any questions there?
No.
Okay.
True North for sure is in there.
Well, yes, yeah. Yep, okay. So I'd make a motion that we approve those. And Gary, you want to second that?
You want
Second.
to list them out, though, please?
Sure can. Is that Retanen? Is that how you put
Yeah,
it?
It
we're
should,
down.
look in that blue folder, the
Yeah.
invoices will be separated over there, right there. And
Okay,
then I gotta ask questions on that one.
okay. Retanen Concrete was $5,490. True North Consulting, $4,428. Tracy Seaman, this is for the transportation concrete work, $8,663.70. And Trevor Seaman, same scenario with the transportation concrete, $575 for a total of $19,156.70. So, it's been moved and seconded to approve that. I'll call for a vote. Primer, aye.
I abstain.
Yep, I expect that.
Second.
And moving on here, we gotta sign this stuff, guys.
So Tracy, that one for the concrete, I don't have in there because I didn't see it yet, so. In the ARPA spreadsheet, so I'll fix that.
There you go. I held this one out of there for now, right?
Yeah. It's not in that frame there.
No, I think that, yeah.
Do you want to do the
Why don't
budget
you?
amendment date?
We can while they're signing that, sure, why not?
So I'd like to set it for Tuesday, October 15th at 9:30. And as you know, some of them are, Conservation's gonna apply for another grant that she got. She needs some spending authority. If you guys do anything with that township loan, and then definitely for juvenile detention. But as Ray said, that's gonna get better hopefully within the month, but.
Okay. So can I get a motion to set that budget amendment hearing date for October 15th at 9:30 a.m.?
So moved.
Second.
Okay, that's been moved and seconded. Call for vote, Primer, aye.
Seaman, aye.
Bierschenk, aye.
Did you have a report?
Yeah, that's in that folder they're bringing.
Okay,
Alright.
we'll just sidestep that.
They grabbed my agenda folder and that's what they put stuff in.
Okay. So is that, the other one's in there as well?
There's the firework and the liquor license one in there.
In there also?
Yeah.
Okay, all right.
And then I know May's couldn't be here till 9:30.
Correct.
And Ray wants you to wait on his stuff.
On the remainder. Well, is there any reports, fellas?
Had a Zoom meeting yesterday morning with Easy Cog. Had a ARPA meeting and a handbook meeting yesterday afternoon. I think that went really well. And I had conservation last night. And the Wildcat shower house is finally getting started.
Good.
We're supposed to start this morning digging the footings in for the whole building up.
Nice.
So then we'll start seeing more ARPA claims for that, right? Thank you. Good morning. All right. So there's the liquor license. Firework. Sticker.
Thank you.
And then there's your firework.
Thank you.
Bet you needed that, didn't you?
Thank you.
You ready?
Sure. Yep.
Okay, I'll make a motion to pass or grant the retail alcohol license to a press. Bar company.
That's right, first, I don't,
It's.
KPRES.
Okay.
Second.
Second on that, okay. Then moved and seconded to grant that alcohol license. Call for vote, Primer, aye.
Seaman, aye.
Bierschenk, aye.
that's just the temporary 5-day one, isn't it?
It is October 1st through the 5th. Here's the fireworks. There you go. Thank you.
do we have a new representative for us from ECOG? That replaced Jennifer? Our contact, so I haven't been notified of that.
Yeah, it's, give me a second to check on it. Alicia,
It's okay, that's,
give me a minute to take on that.
nope, that's fine. I
I
just,
might have to get on the website. I can't, I'm bad with the last name, so.
I know Dean and I had a question come up yesterday, so I could contact him, but I wasn't sure.
Are you good with it?
I'm good. I'll make a motion to approve the fireworks permit for Daniel Moravitz for October 26, 2024.
Second.
All right, that's been moved and seconded for that fireworks permit. Call for vote. Primer, aye.
Same and I.
Merschenk, aye.
And the next thing you can do is my urban renewal report. I still have to file it with the Department of Revenue, even though it's not active, so we just claim 0 on that. And I go in and approve it online, but if you'll just look at it and then initial that.
Thank you. Here's this. Fireworks permit, thank you. Lots of zeros. There you go.
There's 2 things you're going to sign. This is that letter of support you approved last week.
Okay.
This is the signature.
Okay. Okay, thank you.
Ready. All right, we're right here, right? Doors open.
Morning.
Yeah, there's some chairs up front. Each one for department head.
You ready? We'll need a motion to approve that urban renewal report.
Yeah, so moved.
Second.
Moved and seconded to approve the urban renewal report. Call for vote. Primer, aye.
Same and I.
Merschenk, aye.
You need these initials.
Yeah, just initial and I'll put it behind, but I go online.
I
and-
want all 3 of us, don't I? Come back, folks.
Item number 11, we can discuss now too.
Yeah.
We met last week and
Just for your.
also in the handbook committee, we decided if there's a department head that leaves employment or changes positions, we want to put a policy in place to cancel, automatically cancel that credit card. Because even if they hand it physically back to me, I'm worried about it being on other laptops or, you know how your devices save it automatically. So I talked to Farmers Bank, and even though we canceled the HR department and want to issue a new one, they need board action on that. To continue to do it that way until we get a policy in place, and then if we share that policy with them, knowing that an employment change, then they could do it without that. So I'm asking today for you to act on authorizing a new HR credit card and lower that limit back down to $1,500, please.
No problem here. I'll make a motion to approve it.
Second.
Okay, it's been moved and seconded to approve that new HR card with a new limit. Call for vote, Primer, aye.
Seaman, aye.
Deershank, aye.
While you're talking about the handbook, can I ask a couple of questions?
Sure,
If you have time, if you don't, that's
we
fine.
have a moment here.
Back in July, you adopted a new leave policy on vacation and different things. Do you remember that? It was a revision to the handbook, and I just have a question, because you changed the vacation schedule, and then you added, so upon hire, somebody gets 5 days. Then you added a paragraph that says, new employees may be granted additional paid vacation days upon hiring, not to exceed 25 days at the discretion of the department head. So does that mean that upon hire, they can have 30 days?
I think a lot of that's going back to your committee, isn't it, Tracy?
I'm just going by what the handbook, this policy says. And it says, new employees may be granted additional paid vacation days upon hiring, not to exceed 25 days. So if I get hired and I get a week's vacation, can I get up to 6 weeks, basically?
Well, up to 25 days, Ray, wouldn't that be the cap?
That was the cap that was discussed, yes, 25
But this says
days.
granted additional paid vacation days.
Yeah.
It says, it doesn't say that it's inclusive.
Well, and that's kind of what our department head meeting yesterday was.
Yeah, that
Some
was
of
one of
those
the issues.
revisions that they passed, us department heads weighed in on, and we're not 100% content with those. So right now, they're gonna leave the old handbook as is until January 1st regardless. So we have, the department heads have time to look at those policies, not just that one.
Well, I have a couple other questions about this, where you have parental leave, you're giving 3 weeks of paid vacation, or not vacation, I'm sorry, 3 weeks of paid parental leave for the birth of a child and, or placement of a child with employee for adoption. That pretty much mimics FEMLA, which you are required by federal law to have, but you're not required to have parental leave. So does this mean that now they can have up to 15 weeks instead of the 12 weeks allowed by FEMLA?
They
Not-
could
not
take the
paid.
additional FEMLA and paid leave if they wanted, yes,
Well, so they could have up to 15 weeks off.
potentially, yeah,
But only
Paid.
3 weeks would be paid, right?
yep.
Well, unless they have paid leave that they
Right,
can use.
yeah.
And then I was wondering if I could get a copy of the financial analysis of the impact this is gonna have on the budget? Who's got a copy of that?
The only one that was really looking into that was Ron on his department, correct? Did you
So-
have, do you have that in a spreadsheet or anything?
I might have.
Okay.
So we don't have any analysis of what the impact is gonna be on county finances. Okay.
I don't know if the prior HR had anything that she shared with you guys that I didn't see, I don't know that, so.
Okay,
Because that particular, regardless, that one was not gonna go into effect till January 1, right?
Correct. And then it was with anniversary dates, yes.
which is why I asked the questions now, so that
Sure.
it gives you an opportunity
Yeah.
to
And
maybe
that's,
look into some things.
yep, and our department heads wanna meet pretty regularly up until budget time right now with all that, because even, not just that, like the meals and the mileage affects everybody's budget. If we're paying employees more for meals to go to out of state, it affects our budgets all around.
Well, that's not in this.
Right, not in that particular one, no.
But there are a lot of things in this that you adopted that will affect the county's financial position, I would think.
But if I recall, a lot of that was reversed, if you will, until your handbook committee goes through it, isn't that correct?
Well, you guys kind of reversed things last week. and
That's
said
what I thought it
January
was.
1, but that was still the active draft that she was looking at, so.
This is what has been adopted. This is not a draft. This is in the minutes.
Yes, because it was in those resolutions. But as of their action last week, they said.
So they amended the resolution last
Well,
week?
they really, I didn't put it on as a resolution, they put it on as that, those policies will not go into place till January 1. So we do need to,
And I thought we kind of put the brakes on it. and-
Then I think you need to amend your resolution that says it's not effective until.
well, I think we did amend the one because it's put effective January 1. The first resolution did not have that date. That was still in the prior HR was here. We did amend one of them.
Okay.
But that was only the vacation part, not those other ones.
Okay. All right. Thank you, Joe.
I don't want to be the bad guy. I just have lots of questions.
Well, we'll move on here. Ray, item 12 is to review, discuss, and act on Julia Berry status in the HR department.
Yeah, I've been working with her and sort of gauging her progress. She's doing a good job. We met twice, first with just her, myself, and Tracy. And then we met with Haley and Nancy and Alicia and Derek, myself, and Tracy. And I think we've worked out a scenario where the two offices can work well together, at least through May. And then you can decide at that time what you want to do with HR. But in the interim, I think she's doing a good job. Obviously, some of us have been helping her, but I don't think she's going to need help very much. I think she's pretty sharp. I talked to adjusting her wage a little bit, to sort of compensate her for the increased duties. Because essentially she's doing pretty much everything HR person would do, except for those responsibilities that the auditor is going to be handling. So, I don't know what to suggest. I think the discussion was $20 or $21 an hour. The other thing that Julia was saying is that she needs a title, something other than intern, because intern really doesn't convey to people that she can make decisions on how to help them. So I don't know what you think about some sort of interim title, manager or something like that. But that's where it's at. It doesn't seem to have been any bumps in the road. Things have gone smoothly. She could have inherited this countywide meeting in a week, and she's scrambled and putting that together pretty well, so that's a good thing. So that's where it's at.
We've adjusted the duties and the job descriptions. My office took back most of the payroll, insurance, anything related to that, so. Yeah. You can see the list here.
So what will she be doing?
She'll be managing the wellness, the recruiting, retention, interviewing. She'll be assisting with, workers' comp claims, stuff like that. She'll still be working in those other areas with Nancy, but there's plenty for her to do. Anytime somebody changes their new enrollment, new hire paperwork, all that stuff she does. And then coordinating, we do annual employee reviews now in October, so she'll facilitate all of that, accumulate that, so.
Tracy, you've been sitting in on that meeting, is that correct?
Yes, I have.
Okay. You got a recommendation?
Well, for starters, let's go with, her wages is right now $15 for part-time. She's gonna bump up to 3 days a week. And I would like to give her at least $21 an hour pay raise. Starting wage for right now,
Is that 3 full days?
3 full days.
And then she's been doing some work from her computer on those other 2 afternoons. So, I think what we authorize up to 36 hours a week, is that what we agreed on?
Then you'll have to worry about
Something like
paying
that.
benefits too.
Yeah, there's benefits involved.
Up to, maybe it was 30 hours a week. We wanted to keep her part-time, but we wanted to increase her hours.
There would be benefits for the 3 days?
Not at 24 hours, no.
Okay.
Where does
I think it starts at 30 hours, doesn't it?
Yes.
So
Where does
up
benefits
to.
Starts at 30
30
hours
hours a
of
week.
I
benefits.
thought.
Starts at 30.
So what I have to do for every employee in the county, I keep a spreadsheet after each payroll, plug in the hours that they've worked each week, including part-timers. Then the end of a 12-month period, I have to go through and see if an average was over that 30 hours. If it is, starting January, we have to offer that employee for that next year insurance if they would like to take it.
I think if you authorize up to 28, that would probably be plenty. I mean, she's working 2 jobs and going to school, so I don't see where she'll have time for any more than that, really.
Because our employment with the county is pretty well full right now. We got pretty well everybody hired, correct?
There's a few in the works this week, I think maybe possibly 2.
I got 3.
Did we take
Working on
action here a week or so back on her number of hours not to exceed?
I don't believe so.
When she was hired.
Hired her back.
we did.
That's what I was
But
thinking.
that's why Ray put it on the agenda today.
Okay. I was thinking that we,
When
up
she was
to-
hired up to 20 hours.
Oh, when she was hired originally.
That was May 29th, if I remember
Yeah.
right.
Okay. But again, I was thinking that we said, don't go over X many hours. And we had roughly, that time, a wage in mind. So, okay.
Well, like I said, I'm suggesting $21 an hour, 3 days a week. And then,
Up to how many hours?
Or just the 3 days or something.
not to exceed 28. She's been lining this safety, or not safety, the wellness meeting for next Monday, right? She's
Yes,
pretty well
she's-
handling
Yep,
99.9% of that.
yep, she's
Is
done
that
all that.
Monday or Wednesday?
Monday
Monday.
Okay.
at skate.
Yeah, I had it down as Wednesday. There was a discussion on that. So, okay.
Well, that's my motion on that, and then, as for the job description, I guess, instead of
If
trying
that's a
to.
motion, we need to.
Okay,
I have a question.
Over.
Is she gonna work under the direction of the county attorney or the auditor, or where's that?
Well, she'll be under the board.
it will be under the board, but she will also be working with the auditor's office.
I think we should just put her under the direction of the auditor, if the auditor's willing to do that.
I told them I would be, because honestly, I feel like the files should come back to one location too, eventually. Because my concern was when they're over here and the day she's not here, et cetera, we need in there, things like that. We have to continue working smoothly, like if there's an employee verification, those kind of calls, we don't want to make people sit and wait on them, or like a new hire filling out paperwork too. So we kind of discussed some of those issues.
Is that something you guys discussed in your meetings?
We did not discuss putting her underneath the auditor. I mean, I think at this point, let's not do anything until May to see how this goes. I mean,
But if you look at it, in my mind, the only way she could be directed to do something would be from a board meeting. If she's under the control of the board, so that anything she was gonna do, if we needed a quicker decision, you'd have to call a board meeting. And put it that way.
That's with any department head. That's with any department head. Supposedly,
Well,
But
elected
Haley's
officials.
an elected official, it's over you.
yeah.
Yeah.
Right, but.
She could make those decisions.
I would not object to it, but I thought let's move slow at this.
I agree with that.
I wanna move slow. I'm not gonna be forced into doing nothing no more.
I agree with that.
Get this wellness deal next Tuesday over with. This was a lot dumped on her plate.
Yes.
Well, the employees didn't even know that was in the works, so, yeah.
Okay, so your motion currently is for Julia is to bump her to $21 per hour, and her hours not to exceed 28 hours per week. That was your motion,
That's
correct?
my motion.
Okay, do I have a second?
Second.
Okay, it's been moved and seconded, I'll call for vote. Primer, aye.
Seaman, aye.
Pursuant, aye.
Now you got another part you were talking about?
Well, instead of listing, just go with what we kind of agreed on at the meeting. How it's
That
gonna
job
be split up, yeah. Because if you want me to actually list this out, then we're gonna table it till next Tuesday, so I can get the job descriptions and all down.
Well, I think at that time, whether it's next Tuesday or down the road, you know,
Yeah.
the other questions is who's gonna be the supervisor, play the supervisor role. You know, you guys getting back together, I presume, correct?
Okay,
We're just like signing up on our timesheet, you
Sure.
did that today for me.
Correct.
Maybe that kind of stuff.
Yeah.
And I agree with Ron, on like on a day-to-day basis, you guys aren't always in town to know those things, so.
Okay. All right. That it then?
that's it.
Okay. Well, May is here for her 9:30. So we're gonna,
Where would you like me?
Come up in the hot seat.
come on up, please. It's easier to hear you up here,
Yeah, no problem. Gonna join May in the hot seat.
especially with the air conditioner running behind us.
Sure.
Thank you.
I got it from one of those emails from some, one of those group ones.
Okay, just in case you want to put it.
On the map. Well, I've
Or-
already been
oh.
asked to share that with some others, but yeah. we can
Great, yeah,
update it.
if you, yeah. All right, so good morning. I'm here this morning to talk about, I have extra copies if anybody needs them. The behavioral health realignment, right? So on January 10th, the governor made her announcement that she would be bringing forth a bill, which she did and which passed and was signed by the governor on May 15th to realign the behavioral health system in Iowa. As the governor announced on January 10th, there were at that time 13 mental health and disability services districts, 19 areas, so to speak, for substance use services through the Iowa Provider Network. And so her proposal was to take those 31 areas and combine them down into 7 behavioral health districts, with also combining the policy and the funding for mental health as well as substance use. So there were a few other things in the bill, of course, but the biggest one is the geographical boundaries, right, that realignment. So I think all throughout the spring, and, you know, while the bill was being debated, and then when the bill was passed, HHS was required to create what they call a transition plan. And that transition plan was required to be released on July 1st. So kind of all in that time, we knew, because there were draft maps that were released, that there was a good likelihood that all 9 of our counties in the East Central region would not remain together. Unfortunately, when the map was released on August 1st, that fear that we had became reality, right? And it kind of broke our hearts to know that there were 3 counties that are currently in the East Central region that would not be in the district that has the bulk of our counties. And as you see on the map, of course, Benton and Iowa counties are 2 of those, and then the third one is Bremer County. Bremer County goes to that district that is purple, and Benton and Iowa counties go to that district that is the blue color in the southeast part of Iowa. So that's our reality, you know, and what does that mean for us? I want to be sure that we're clear, and HHS has been pretty clear about this. The map, those districts, those behavioral health districts, are, the purpose of the boundaries are really administrative only. because people in this vision of the realigned system, we have the same eligibility criteria, we have the same services, we have the same access standards across the state. For example, right now, there might be a little bit, there's not huge, but there are some tweaks as far as eligibility standards in the mental health regions across the state. HHS is saying everybody's going to have the same eligibility standard and the access to services is going to be the same. So this map doesn't mean that the folks from Benton County no longer go to Lynn County for services, right? The folks in Benton County can go to Lynn County, they can go to Johnson County, they could go to Jasper County. They can go wherever services are, and the eligibility stays the same. The access stays the same. So this geographical map is really who is going to be administering those services. So it's really about the administration. There will be administrative services organizations. The RFP in the state's transition plan, it said that the RFP for the administrative services organizations was going to come out on or before September 30th. And they gave us a very nice surprise. I think it was a very nice surprise. The RFP came out last week on September 1st. So we have somewhat more of a definition of the scope of work that will be expected of the administrative services organizations. And as I read through it, and I've read through it a couple times, the more I feel confident that this doesn't mean, right, that we no longer have a relationship with the folks in Benton County, because it's the scope of the work and the work also ensuring that the administrative services organizations work with one another, right? And in the bill, they maintained the legal definition of legal residency. That's in there. But with the equitable access standards and equitable eligibility, I don't know that legal residency is going to be as big of a deal as it always has been. So I think we'll see a better flow of services from people from one to the other. I'm going to stop there. Do you have any questions before I keep going? Or comments?
So in other words, a client from Benton County can go to Lynn County and still get service.
Absolutely.
Okay, but it'll come out of the pot.
That will be that, and I'm sorry, the districts are numbered and I don't have the numbers on there. I've just been calling it the tan district and the blue and the purple, right? So it'll come out of the ASO, who's in the blue district's budget. However, Tracy, HHS has not been real clear yet. There is going to be a funding formula. We know right now our funding is based on per capita, the number of people who live in the region times the dollar amount that's, for this fiscal year in the legislation. They've said that the funding formula will not be solely based on population. So I think there's going to be a few other factors that come into that. And kind of got the impression from one of the town halls that HHS hosted, a little bit will be dependent on need and availability of services. So it might be like, gosh, a lot of people from Benton County go to the Access Hub, but a lot of people from Benton County go to Lynn County. And so the ASO for that blue district, we're going to take all of that into consideration when we give you your funding. So I'm not sure yet, right, if it's going to be advantageous or not. I know that when HHS built the map, they did look at those traffic patterns. In fact, Ryan Wood and I from the mental health region that's in the southeast part of the state now said, let's just call HHS and tell them I'm going to keep Benton and Iowa and you keep Louisa and Des Moines counties, right? Because the tan district got Louisa and Des Moines, and then the blue got Benton and Iowa, and it didn't make any sense to us, but we didn't get to make the decision. So I do know that however this pans out, right? Whoever the ASO will be for this blue district here, if we are named the ASO, are committed to working together, right? I mean, we have relationships here. And so those are not things that's like, oh, sorry, now the line is different on this map, all of that work is done. I don't know that the work is done, and I think that we want to be collaborative with whoever becomes the ASO that will cover Benton County to make sure that services continue and to make sure that people still have that access that they need.
Will you stay as the ASO for the tan part, or you don't know yet?
We will be applying to be the ASO
Got it.
for District Number 7, the tan part. I don't, right, we don't know if we'll be selected, but we'll be applying. The state is in that procurement process right now, so the RFP was released last week. And our application, all applications are due October 18th. And then there's a bidders presentation finalists, so to speak. They didn't necessarily label it as finalists. Will be invited to present mid-November, mid to late November. It's like the 20th and 21st, I believe. And then HHS will announce who the ASOs on December 30th. So, right. It's all gonna happen really quickly now.
But everything's as is till next June 1st, July
Exactly.
1st.
Yes. Thanks for bringing that up, because that's a great segue for me to my next piece, Gary. So,
I can,
thank you. Can I keep one? Can I keep one? Thank you.
May, you would ask unfair questions, sorry.
Okay.
I was just.
Do you want to rephrase?
What do you expect funding to look like
Yeah.
for our people?
I really don't know. I mean, I know that HHS has said the funding formula will not be per capita. And when they keep using the word formula, that's what makes me think there will be other factors that are put into it, that it won't just be per capita. We do know, of course, that with this behavioral health realignment, the state will use the federal mental health block grant, the federal substance use block grant, the state allocation for mental health services, the state allocation for substance use services, and some of the tobacco and gambling money. All of that money will go into the behavioral health system fund. And then how it's divided back out, I don't know. But I do know that it's a greater amount of money. There are more services that the ASOs will be responsible for. So I don't know how it gets divided out, right? We don't know any of that yet. But the administrative services organizations will be considered what they call instrumentalities of the state, which means the ASOs will have the authority for those federal block grant dollars to flow through the ASOs out to providers and communities. So lots of requirements with those federal dollars, of course, and the ASOs will be responsible for making sure that those federal requirements are met. So there's a lot of learning to be done in the next year and a half.
So we don't have an answer until these contracts are awarded, basically for the ASOs, on what is going to happen with our local employees?
Yes. Like, we have a plan, but it's dependent on whether or not we're selected as the ASO, if we can put that plan into action. Does that make sense? Okay. We have, since the governor's address in January, as the CEOs, we have been in mutual agreement that if we have employees whose role is to serve the region as a whole, that as an ASO, that we would work those employees into our plan. If we have employees that are very geographically based, then we might need, like in a situation like that, those employees to go to the ASO that would be in the new district. So a lot of it's going to depend on who the ASOs are and what we do. So, we do have a plan. I have a table of organization that we will be submitting with our proposal, but what if we're selected as the ASO will be whether or not I can put that plan into action.
I got a question, Doug, do you see job eliminations here?
If you're merging a bunch of these things?
Yep, that's a really good question. I would say that if the East Central region is named the ASO, our commitment is for 0 job eliminations. Right? If someone else is named the ASO, I can't speak for them and what their intention is. I do know that there's plenty of work to be done. There's not, it's not like there's less work to be done. To be honest with you, HHS, one of the reasons that they gave for doing this realignment was duplicative administration, right? There are 11 mental health and disability services CEOs in the state. There's not gonna be 11 CEOs in this new system. So elimination might come at my level, at the executive director, at level of the administration. But as far as like the daily work that needs to be done, that doesn't change. And HHS has really great vision right now about making services accessible for all people. And we're a rural state, and so we need people locally on the ground to do that lift, to make sure that services are available for people at the local level.
Thank you. I really appreciate your coming here. And are there other leaders that are in a similar position as you may from the other region where we may be connected, that is possible for us to forge some anticipatory relationships?
Yeah, that's a super question, Jean. I do know that Mahassey, the Mental Health Agency of Southeast Iowa, I have to get that acronym right. Mahassey is intending to apply to be the ASO for that blue district. And Rayanne Wood, the CEO for Mahassey, has had some conversations with me already about, what does this look like? And, we've shared about what services are available in these counties, in Des Moines and Louisa and Benton and Iowa.
How does this work when it goes into effect? Now, we got some employees that used to, I don't know if they still do, go down to Johnson County and help out. They still do that, Mona? Okay, so that's gonna be the new TAN district.
Right.
So can we tell them to go fish and our employees stay here, or how's that gonna work? Or you probably can't.
So first of all, I read the RFP and I see that service coordination is an allowable activity for the ASOs, right? And before that RFP came out, we weren't even sure that they were gonna allow us to continue to do service coordination. So it is in the RFP. It's a little squishy as far as really giving us a lot of direction, but we are, we're taking our interpretation of the RFP to write in that we will have service coordination. Again, if we're selected as the ASO and we can put the plan that I have into action, then I'll be talking with you about that. How about that? It's really tough right now, right? Because we just don't know. And I have to honor and I have to be respectful of the state's procurement process. And they can't give us necessarily any more information than what's in the RFP, and we can't ask those questions, and those are unallowable activities in a state procurement process. So I have lots of great ideas that I'll be back in January. How about that? Speaking of January, one last thing with the realignment. So that state transition plan had other activities that said these will be done on or before June 30th of 2025. And as Gary said, the administrative code that governs the mental health regions, 225C sunsets. It stops being on June 30th of 2025. So we, as a mental health region, will cease to exist. On July 1st of 25, 225A will be enacted, and that will be the administrative code that governs the work of the ASOs. that time period from December 31st or December 30th, if they name the ASOs on December 30th to June 30th, will be a time of transition. And they listed it among activities like deciding that funding formula and the allocation of how much money will go to each district and the responsibilities, right? But also determining that eligibility criteria, determining access to services, determining what we're gonna do about workforce development, because we know we have a workforce issue. So there's a lot of work that still needs to be done. The transition plan says by June 30th. The way that the transition plan is formatted, it kind of looks like some of that stuff isn't gonna start until the ASOs are named, but I don't necessarily know that. HHS might be working on that stuff already and just can't tell us. But we have been particularly concerned with that time period of January through June because it is our priority that people continue to receive services, right? I don't, when the light goes out on 225C on June 30th, when that light goes on 225A on July 1st, I don't want to see a discontinuation or gap in people's services, nor providers' ability to bill and get paid. So I'm very concerned about that time period, that 6-month time period of transition, that whoever the ASO is, that contract authority is established so that they can enter into contracts with the providers, so it's just seamless transition. And the people who receive services don't even really notice the difference. It's just where the bills get sent to, right? Will be the biggest difference. And so that's education and outreach with our provider network as much as anything else. So I also handed out, and Gary gave me the transition, to our FY25 priority initiatives. So you're familiar with these. We've done these for the last 4 years, that we have our broad strategic plan, and then each year we set these priority initiatives, which are essentially our action steps, right, to get us to those big goals. The format, same as always, the status key at the bottom, and then each quarter I move one of those symbols up into the bubbles next to the priority initiative just to document our progress and to make sure that we hold ourselves accountable to the work. This year's priority initiatives are wholly centered around the realignment, right? So the very first priority initiative is we will support the transition to ensure that access to services is not compromised. I already talked about that. We want to make sure that for people who receive services and the providers who deliver those services, it's as seamless as possible. We also say that we'll maintain the highest level of integrity and commitment to being the East Central region, right? Our work with all 9 of our counties and our commitment to all 9 of our counties is the same as it's been for the last 10 years, for these next 10 months. We have work still to do. And we want to make sure that we're doing that work and we're communicating with people and that people understand this is not the time for us to wring our hands and to give up, right? This is the time for us to continue to show that we are a strong region and that we take care of the people who are in our 9 counties. We say we'll foster and strengthen our collaboration with a broad array of services. Here we list our traditional services, but we also bring in substance use because the bill creates that blended policy and funding for substance use disorder. We also talk about public health agencies because right now a lot of the gambling and tobacco prevention, it's different in counties, but in a lot of counties it is the public health department. So we want to work with them, that if the administrative services organization has that responsibility for the tobacco and the gambling prevention, that we have great partnerships with the public health, and then the area agencies on aging. So HHS is carving out, if you will, aging and disability services. It's now a new bureau at HHS. There will also be an RFP for what they're calling disability access points. And those RFPs are scheduled to be released on September 30th, but they surprised us with the other one, so I'm checking every day to see if that one comes out a little bit earlier too. So the disability access point will have some similarity to what we've always done as a region, and there is the possibility that we will independently apply to be the disability access points for these behavioral health districts. There's also the possibility that we will collaborate with one another. Depends on how that RFP is written, and so when that comes out, it's really gonna drive what's next. But I have commitment, and I am also committed to working with the other CEOs right now on this eastern third of the state, that we may work together on that disability access point RFP. So we'll see if it prohibits us or allows us when it comes out. Okay, and then we'll work to, once the map is finalized, we'll work to submit a proposal. I've talked a lot about that. The next two in priority tier 2 is that we will ensure that our staff and our regional partners receive training and information. Once the RFP came out, we're working on that now, our staff receive bi-weekly emails, and once a month they have what we call Q&A with May, where we just do a Zoom meeting, and I just share, like what I know and what our plan is. We had one yesterday, they're well attended, so we're just trying to make sure that we keep that communication open. And then also regional staff well-being. There's a lot of uncertainty here, there's a lot of ambiguity. And with that ambiguity, there's fear and speculation, right? Like what's gonna happen to my job? And so we have a commitment this year that we're checking in regularly with our staff and putting some measures into place to make sure our staff well-being is addressed. I can get caught up real easily on, I've got a 65-page proposal to write in the next 5 weeks. But we don't want to lose sight of the people, right? And the people that work for us, as well as the people that we serve. And so we set that as a priority because we didn't want to lose sight of that. If we're assigned as the ASO, then us as the current region will proactively build a new team and facilitate the implementation of an advisory council. You should know that every ASO is required to have an advisory council that is made up of 3 members that are elected officials, 3 members who have experience, and that can be a person with experience or a family member, 3 essentially providers, it's not necessarily worded like that, and 1 member who's law enforcement. So there will be an advisory council in every district. And the ASOs are required to develop a method for recruitment, is how it's worded in the RFP. And then the last priority, or the last 2 priorities, something that's super important is the region will leverage our partnerships and advice from parties to develop a business plan and address the resolution and transfer of assets and risk to the ASO. So this is where it's really important for us to have a conversation, right? Because there are 2 vehicles? There are 2 vehicles that might be sitting outside. One of them might be somewhere else right now, but right, 2 vehicles that were purchased by the East Central region, they were purchased by Benton County, reimbursed by the region, they're titled in Benton County. What do we do with those vehicles? And so we have the transition or the transfer of employees. I'm gonna tell you, one thing that weighs heavily on my mind right now. If we're not selected as the ASO, then no matter what, whether Benton County is in our district or not, if we're not selected as the ASO, all of our employees, we're out of a job. And we have employees, not necessarily here as much, but we have employees across our region who have been with our counties for years and years and years and years and years. And they have a lot of vacation time. And that's a risk right now. And so we have to figure out, we're working with our attorney, we're working with other people across the district, and we have a committee yesterday that began addressing it, as well as the regional governing board. We'll have a legal obligation to pay out that vacation time. So I am encouraging all of our employees to use their vacation time, number 1, again, for their well-being, right? If we work too much and we don't take our time off, then it impacts our well-being. Number 2, I'm concerned, and I have a legitimate concern region-wide, that if we have to pay out a whole lot of vacation, that we won't have enough money for services next May and June. And I don't want people who receive services to not receive them because we have this legal obligation to pay out that vacation time, vacation or sick. You know, some of our counties even will reimburse some sick time that people have banked. So it's something that we're working very closely with HHS on. It came to their attention within the last 6 weeks, because I might have brought it up. And so they're asking us to monthly give them a report of where we're at with, like, how much is our risk. So the time between January and June is going to be really important for the transition work, and that's that priority. I want to point out that it's ironic for a lot of different reasons. This is now the time that our regional governing board representation changes. So back when we changed the makeup of the regional governing board, because there could only be 49% of county boards of supervisors on the regional governing board. The plan that we made was that we kept Lynn and Bremer counties, because that was the leadership, right, chair and vice chair of the region, and then we just did it alphabetical. And alphabetical after we did 18 months to get us on the schedule of boards of supervisors elections. So that means that those 6 members who have been serving, and Gary's one of them, has been serving since January of 23. Now we go into our rotation. So January of 25, we have 3 members who drop off and 3 members who come on. The members that drop off are Dubuque, Delaware, and Buchanan counties, because it was alphabetical. Buchanan, Delaware, Dubuque, right? And then the members who come on are Jones, Johnson, and Iowa, which is ironic, right? Iowa County's coming on, but Iowa County's not in the TAN district. But I think it's super important for us to have the Iowa County representative, because we have to talk about all this transition stuff and how are we going to help and how are we going to ensure the continuity of services. So just want to, like, bring that to your attention, like there's going to be that change right now in our regional governing board, not necessarily affecting Benton County. Benton County will still have a representative on, so you'll have to appoint in January your representative again. And then the very last priority initiative is probably the favorite one we've ever had, just because it's kind of tongue-in-cheek, but we're going to reevaluate December 31st. Right? When this comes out, and when we know who the ASO is, and if we're the ASO, we're going to get to work, and we're going to work on that contract authority and making sure that we transition well. If we're not the ASO, we're going to develop a plan for how we help the ASO to, again, back to that commitment and integrity, that we'll be a good collaborative partner if we're not the ASO. And we might write some new priority initiatives for that last 6 months.
I'm sure the state will be working with us for budgeting on all that, regardless, I hope.
Oh, I hope so too. Budgeting right now is causing me a lot of consternation, because I get it that as soon as possible, and with the contract that the ASOs get from the state in January, we'll have an idea about budget. But our counties start budgeting before the end of December. And so I'm not exactly sure so if you find out anything, that let me know, Haley, that I don't know, but yeah. Other comments, questions? It's a lot right now.
Yeah, I don't envy you.
What's that?
Yeah, I don't envy you. Your mind's got to be spinning.
It definitely is.
Yeah.
Yeah.
As well as the ladies here, big question marks.
I'm not a person, I've never been a person who sits around and waits very well. I'm sure you probably can figure that out from knowing me. And so we've been real proactive. I mean, I know there are other regions who have been like, well, we'll wait till the RFP comes out. We didn't wait. We started a process back in April, and we developed an interim plan, even like not knowing what's in the RFP. We anticipated some stuff that might be in the RFP. So our staff have all worked really hard these last 4 or 5 months. And I have things in a folder that I can copy and paste and put into our proposal, because we worked really hard of just like getting data, gathering data, getting prepared. And so, I mean, I feel pretty good about it, but there's still, it's like, if we do this, then that, if we do this, then that, and what if they don't like this? And yeah, so there's a lot.
Appreciate you coming forth with this.
Yep, and I'll be back, right? I mean, there's a lot of transition that we need to do, and I have a commitment, and I know that the Regional Governing Board supports the commitment to ensuring that the transition, especially for our 3 counties who are not in District 7, have the utmost support during that transition period from January to June.
Thank you, Mayor.
Have a great rest of your day.
You'll hear these being shared. Absolutely.
Ray, we're back to you.
All right, I've been working with Shelby at Conservation on essentially 4 properties that are titled to originally Benton County Game and Fish, which has now Benton County Conservation. These properties were one-room schoolhouse properties, 1-acre properties around the county. The one we're here on today is located roughly on the intersection of 23rd Avenue and 65th Street, so northwest of Vinton. This is a property that was deeded to the Benton County Fish and Game Club in 1948. I don't think it's ever been used for anything since then. It was deeded to the Benton County Fish and Game by the Vinton-Shellsburg Consolidated School District. Now, originally the property in 1865 was deeded to Eden Township for the use as a one-room school. I cannot find, and I've been working with Marla and John Martin, Marla in the recorder and John Martin in the auditor's office, any deed that actually transfers it to the Vinton Consolidated School District. In any event, this property, it was unmaintained and basically grew into be just a huge thicket of trees. In 2011, the derecho came and just wiped it all out, and it's just a mass of intertwined growth. And the estimate cost of cleaning it up 2 years ago was over $10,000, which I'm sure that's increased now. Benton County Fish and Game, or the Conservation Commission, doesn't have, the property is situated where it doesn't provide them any suitable use. It's not located near any parks. They have no need for a storage or any kind of building on that location because it doesn't suit any of their needs. They came to me and said they would like to dispose of the property. Well, given the limitations on the property's value, because it's essentially a jungle, is what I was told, and that there may potentially be a deed issue, what we decided to do is to quick claim it back to the owner of the original parcel that it came out of. There was not a there was a limited use clause, but there was not a reversion right in the deed itself. By doing that, we're accomplishing a couple things. One, we're putting it back on the tax rolls, which is a significant public purpose. We're also placing it in conformity with our land use ordinance so that it can potentially go back someday being farmable ground. So the Conservation Commission signed off on the deed last night, but it needs your approval also before it can be transferred to Height Susan Farm LLC. That's who owns the property joining it, or surrounding it. It's actually cut out of this parcel that belongs to Height Susan LLC Farms. So simply I just need you to vote to approve the transfer of our interest, the quitclaim, approve the quitclaim deed to Height Susan Farms LLC.
Questions, gentlemen?
So moved.
Okay.
I'll second it.
All right, it's been moved and seconded to do a quick claim deed on that 1-acre parcel back to Height Susan LLC, I believe you said?
Height Susan Farms LLC.
Farms LLC.
Yep.
Okay, I'll call for a vote. Primer, aye.
Seaman, aye.
Pursuant, aye.
Very good.
Okay, last week I was contacted by Lynch Dallas, the law firm out of Cedar.
Questions, gentlemen? Okay.
Make a motion to approve the signing of the dismissal of the Kristen Nelson lawsuit.
Second.
Okay, that's been moved and seconded. I will call for a vote. Primer, aye.
Seaman, aye.
Pursuant, aye.
Okay, I have happy news. Derek passed the bar on Friday, which was a big day for us, because we've been so excited about him becoming full-time. So I believe you have the resolution.
Yep, I just gave it to him.
Yep, just got it.
So a resolution to promote him to full-time assistant county attorney at $85,000 a year, effective Monday.
Okay. So here's the resolution and the resolution numbers at the top. Well, congratulations, Derek.
Thank you.
He was sure sweating it.
Gary?
My plan is to have either myself or Derek start to attend these meetings on a regular basis, now that we're back to full strength finally.
Okay.
So hopefully that will work out. It's kind of complicated because it's a court day for me in juvenile court every Tuesday.
Okay.
I'll make a motion to approve the resolution number 24-83, hiring Derek Marsh, full-time.
To approve his
85,000.
promotion.
Yes,
Mhm.
for $85,000 a year.
Okay. One
Second.
All right, that's been moved and seconded on Derek's promotion. I will call for a vote. Primer, aye.
Seaman, aye.
Pursuant, aye.
Very good.
Thank you, gentlemen.
It's with Tracy right now.
You know,
Ray, you got those certificates, right?
for what?
You got those other certificates we got you for Derek to be appointed?
Oh,
They might
think
be,
so.
they might be upstairs in that folder.
Yeah, for swearing in on Friday.
Yep.
Yeah, I'm not sure, I have to look. This one's pretty chaotic.
Copy of this, Richard.
And I'll get you, Haley, a copy of the Kirsten Nelson.
Well, are we signing it today, passing them on around so it's all on one signature, or what do you wanna do?
It has a signature line for each of
Yeah,
you.
yeah,
So,
yeah. And have you signed this copy, Haley?
that's fine.
You can do that.
This goes back to Ray. Is there signatures there?
On the very last
Okay,
page.
I'm
Mine's
sorry.
on the second page.
Oh, there's another page. Okay. Any unfinished business? Okay, public comment. Alrighty. And the very last item, 17.
No, I was gonna ask Ray something. So this is a contract, not just a, it looks like it's a contract, an
What's that?
employment contract?
For what? No, this is the Kirsten's settlement agreement. The other thing was just
Okay.
by resolution that I
Yeah,
said.
Oh, I just had a quick question. What did you say, Ray, that that amount was on that settlement?
30,000.
30,000, okay, thank you.
Which I just found a typo in this one, Ray, so we'll redo it. Derek is not a her.
Oh, wow.
So,
Well, in today's age, maybe.
Yeah,
I'm just
yeah,
kidding.
Yeah, no comment.
We'll tweak it.
I'm
and
so
get it-
sorry.
We'll get it
Can you,
fixed.
how can you just have the board
All right,
approve
item
resolution
17.
to give away property?
No, we did a quick thing.
No, but you have to follow the procedure that says they
You wanna
have to do a
second that
resolution,
motion?
second
Okay,
their proposal.
all those, call for vote, Primer, aye.
That's my question.
This is a.
Your shake
actually
eye.
the name of
Okay, very good.
Conservation.
Thank you.
And they did the process out
You
there.
made the motion?
But it says, "Most of the property,
I was listening.
Tracy,
the board shall
No,
set
I
forth
think
its
that's a
proposal in a resolution
muddle.
and publish notice of the time and place of public hearing."
It's not their proposal. That's what I'm trying to say.
Who's the property?
Benton County Conservation,
So it's in
their name, not the county
but I
specifically.
didn't think the conservation should dispose of property.
That's why you guys have to sign off
Yep.
on it too.
So
Yeah,
that's
so
why,
there's-
why don't they have to follow the law?
I'll fix that.
That's
Just
what
copy
I'm
that.
Supposed to
Ray and I didn't catch it.
Oh, that's
Sorry.
no problem.
do. You say we need your resolution,
Okay, good.
an agenda, you say we have to do
It
resolutions.
says the board shall set